So there is one topic I wanted to discuss really quickly just because there's a perfect example all over social media right now. The osteopathic tenants state that the body, mind, and spirit are a unit. And in order to have a healthy body, you have to have a healthy mind and spirit. They all kind of coalesce to make you who you are. I think that's pretty common knowledge now, but when A.T. Still, the founder of osteopathic medicine, came up with it, it was kind of a new concept. I'm giving you that information because Mikayla from the Secret Lives of Mormon Wives has shared a lot of her chronic illness and eczema. In season 1, she shared that she has extensive eczema. She's tried many treatments, seen many doctors, and nothing has really benefited her. And when I was watching that, I was thinking, something's missing. Like, we're missing something. And I don't know anything about her healthcare team or what kind of treatments she had tried, or whether or not her trauma and sexual abuse had yet been identified or treated when all of that was going on. But what I do know is season 2 came out and she started talking about her healing with her sexual abuse and trauma and how her body has reflected that. So a lot of times patients come to me, they have seen a list of doctors, they have this symptom condition, and they feel like they haven't been given an answer, they haven't been given a treatment that works, and so they really just want to figure out what's causing it. What is the underlying cause? Is it something that I can fix at home? Is it something I haven't tried yet? Why has nobody been able to answer me? And a lot of times they say, well, people have told me this is all in my head. People have told me that this is all my anxiety or this is all my depression, and if I just got that fixed, it would all go away. But this has been an issue before I had anxiety, or this has been an issue before I had depression. And so a lot of times when I see them, first of all, I'm going to obviously roll out any potentially dangerous medical causes or anything that we need to treat urgently. So like the top of my list, of course, of things to like rule out or make sure that they're not having is like cancer, diabetes is a potential, high blood pressure, blood clots, life-threatening illnesses. So I go down that list. I start to look into the more unique things, like maybe there's an autoimmune condition going on, maybe there's some hereditary thing going on, maybe you have a deficiency of some sort, maybe it's something in your diet, your exercise routine, your sleep, all of those things, which I think are more like classic medical questions. And then I do ask, have you had any increased stress? Have you been working through anything? Has anything changed in your life? We have a depression anxiety questionnaire, screening questionnaire, so I have everybody do that. And if there's some things on there that I think could potentially indicate depression or anxiety, then I try to address that with the patient. And in no way am I trying to dismiss their medical condition or symptoms. Like, for example, fibromyalgia, a lot of people said for a long time, like, oh, they've told me it's just in my head. We know now that's not the case. Like, the pain they feel and perceive is very real. But that pain does respond to cognitive behavioral therapy and SSRIs, which are antidepressants. So we know that when we treat the mind, the physical symptoms, the body's symptoms do get better. So sometimes we refer to physical symptoms related to mental health as somatic symptoms. Sometimes it's not that clear. Sometimes you do have palpitations, you have like SVT or PVCs, things like that, true medical conditions that people have told you for years are just anxiety. That's why I do all the testing I do, is to rule that out. But a lot of people do have PVCs, and a lot of people either don't feel them or it doesn't disrupt their life. It's not an issue that they would go to a doctor for. So when somebody comes into my office and we see like occasional PVCs, yes, you have PVCs. There are medications we can use for that. But my question is, are the PVCs an issue? Is that feeling causing you anxiety that's really more of the issue? And that's not necessarily that you need an anxiety medication to treat your PVCs. If I just tell you these PVCs are not dangerous to your health, or this is not causing you any harm, and that makes you feel better, then you don't need a medication to treat the symptoms of it. So I think just having that conversation, and I try, like, you have to build a relationship before you tell a patient, hey, I think your anxiety could be contributing to some of your symptoms or making them worse. I think you have to build a relationship with a patient before they're ready to hear that, especially if they've heard it over and over again, that, oh, they're just anxious, or, oh, they just worry too much, or, oh, it's no big deal. All of your tests were negative. You're fine. It's no big deal. Like, that's not an answer that makes anybody feel good or that anybody wants to hear from a medical professional. So I think maybe bridging that gap by talking more about the mind, body, spirit connection, and how all of those things are so intertwined. And a lot of times our bodies know that there's stress or something is bothering us before our minds can interpret that or relay that or discuss that. So I do think, obviously, if you have severe eczema, you need to address your allergens, your triggers. Like, you need to remove things that you are allergic to. You need to take medications to help with the allergic response and inflammation. An anti-inflammatory diet is great for conditions like that. But I think that Mikayla is just a really good example of how you can have chronic illness. Yes, it is a very real chronic illness, but to treat it or for her to have any further improvement, she also had to look at her mind, body, spirit connection and heal her mind, heal her spirit before she could go any further in healing her body. And I hope that helps healthcare professionals when they address a chronic illness, especially if it feels like, what am I going to do next? Like, they've had all these tests done, they've had all these images, what answer are they looking for me? You know, they maybe don't have the full picture themselves. Maybe they haven't been able to put it into words yet, or they haven't even realized that it could be connected. So maybe just asking more of those questions of our patients, getting to know them better, building that relationship more. And then also, like, I hope that helps patients realize, like, especially my patients, if I suggest in any way that your mental health might be contributing to some of your symptoms, it's really not me trying to minimize your physical symptoms or dismiss your concerns in any way. It is truly me trying to figure out how to best treat you as a person and all of your symptoms completely.